please mention in the chat box. So today we will be discussing certain tables from the textbook. Those who have the textbook, this will be easy for you to understand. These tables are just after the chapter of sterilization, cleaning, and disinfection. Okay. So those who have the textbook, just mention the page number in the chat box. Standard procedures for sterilization, cleaning, disinfection of equipment. Few tables are there that we will discuss for today. Okay. So general equipments or reusable personal protective equipments, how can we reprocess them, or are they eligible to be reprocessed? Okay. So N95 mask, surgical mask, okay, these are not supposed to be reprocessed. You have to dispose them as soon as you have used them. Okay. You don't have to wash the mask and use it and dry it and use it the next day. No. N95 mask, surgical mask, dispose them after being used. Okay. Discard it in a proper waste bag, which is mentioned. Okay. Then HEPA filter, HEPA, this P100 mask. Okay. Just like we have N95, there are N100, P100 masks. So they are more robust in their structure, but their filters can be removed. Okay. You can put new filters every day. So only dispose the filters. You can separate the filters from the mask, discard the filter, but the mask you can clean it with detergent and water, dry it, or you can disinfect the entire mask with just spirit and reuse it. But filters have to be discarded and changed every day. Okay. And that is how you take care of P100 mask. If you are having an eye protector, goggles, face shield, it's recommended that you use the disposable one. Okay. If disposable one you are using, discard it after every use. But if the eye shield and goggles, these are reusable ones, after every patient use, you have to clean it with detergent water, dry it, disinfect it with 70% alcohol, soak it in 1% hypochlorite solution for 20 minutes and rinse and dry. Okay, so you have certain options. Okay, either detergent water, soap water, dry, and then dry it, spirit, or 1% hypochlorite solution for 20 minutes. Okay. Next, if you are using gown, again with gown, it's recommended that you use a disposable one. But if you have the cloth linen gown, which is reusable, you have to set it to laundry within the healthcare facility. And in the laundry department, they know how to reprocess the gowns, which are usually soaked with blood, body fluids, and all. Okay, so 70 degrees Celsius to 80 degrees Celsius water temperature is used with detergent to clean it. Okay, or if it is a white gown, then you can use bleaching powder. If it is a colored gown, do not use bleaching powder. Okay, disposable one, directly you can discard it. And for drying, under the sun is ideal, or you can use a cloth dryer in monsoons and all. When it comes to apron, if it is reusable, same process, detergent water, or you can use a 70% alcohol to wipe the apron properly and then dry it. Disposable ones directly discard in the waste bag. Cap and shoe covers, it's usually disposable ones. Okay, after single use, you have to dispose. But some surgeons, they have their own personal caps and all, not shoe cover, but personal caps. So that is reusable. So same laundry department will take care of it. Okay, 70 degree to 80 degrees Celsius is the water temperature used with detergent water, and drying is done under the sun. Okay, gloves, you will never reprocess it. Gloves will always be disposed. Okay, boots if you're using, that is reusable. Rubber boots, okay, detergent water or disinfect with spirit and dry it. Needles and syringes are never reused. Okay, it's always a standard procedure to discard them in a puncture proof container. Okay, and the container should have the biohazard symbol. Okay, and do not wait for this container to fill to the brim. Once the container is one third, it is full. Okay, immediately you have to discard the contents. Okay, don't wait till the container is completely full. That is a biohazard. And if there is any equipment which has patient's blood on it, okay, or any soiled patient care equipment like stethoscope, um, BP apparatus that has touched the patient, okay, if it is not of a cloth material, you can wash it with soap water, okay, and or you can wipe the entire area with spirit and or hypochlorite solution, okay. And between every patient use, you have to clean it. BP machine or stethoscope, always clean it or wipe it with spirit between every patient use. Okay, every new patient, it has to be cleaned. Cuffs of the blood pressure apparatus, which is usually made of a cloth material. Okay, it has to be cleaned with soap and water or appropriate disinfection. Infectant can be used. If the material is not washable, then you can wipe it, okay, with spirit or hypochlorite solution. And if it is a cloth material, after using detergent water on it, dry it in sun or dry washing. And any instruments that has been used on the patient, okay, laryngoscope, artery forceps, or any instruments, okay, make sure you remove all the protein, organic, inorganic matter at the point of generation. Okay, if it is an OT, soon after the surgery is done, in the OT itself, manual cleaning or enzymatic cleaning has to be done, and then it will be sent into the sterilization department. Okay, you can't send blood stained, body fluid stained, dirty equipments with all the organic matter on it as it is to the CSST. Okay, it has to be manually cleaned at the point of generation, and then it has to be sent, okay, for reprocessing. So far, is it clear to all? When it comes to ambu bag, along with the mask, okay, ambu bag along with the mask is personal for every patient. You can't use a mask used by one patient on another patient. Mask has to be changed. But the ampu bag, you cannot afford for every patient new ampu bag. That's not how it works. So ampu bag, you can clean it with detergent water, okay, and then you can dry it and then send it to the CSSD. They will do the further reprocessing. Mask, if even if the patient has left it behind, discard it. Okay, do not use it for a new patient. So when it comes to oral thermometer, okay, usually in IPDs and OPDs, after each use, it has to be disinfected. Either you use 70% that spirit solution, okay, or you have to immerse the oral thermometer in glutaraldehyde solution, okay, or hexachlorophene solution, cetrimide solution, okay. There are different solutions for it, for at least 10 minutes, and then use it on a new patient, okay. When you're using the 70% alcohol for 5 minutes, you have to wipe it after every outpatient session. Okay, without wiping the thermometer, do not use it on a new patient, even if it is in inpatient department or OPD. Okay, these things has to be taken care when you're dealing with thermometers. Rectal thermometers after each patient, okay, thoroughly it has to be washed with detergent water, then dry it, and then disinfect with 30%, 70% alcohol for 5 minutes, and then you can use it for another patient. Rectal thermometer should be used only for rectal temperature noting down. It should not be used on any other body part. Okay. Then oriscope in the ENT department, the disposable earpieces should be used whenever possible, because after each patient use, you can dispose the earpiece. Okay. Otherwise, if the disposable ones are not available in the ENT, then after every patient visit, it has to be cleaned with detergent water, disinfected in the CSSD, okay? Or you can use your regular spirit to wipe it clean and then use it for the next patient, okay? Earpieces, if it is reusable one, wash it with hot water and detergent, or 70% alcohol. Patient shaving, after each patient, immediately discard the razor. You will not use that razor for any other patient. For every patient, there is a personal razor that is soon after using on them, it is discarded. Okay. The blade has to be discarded. Bed end frame, bedside locker, cardiac table, these all furnitures are there, no, near the patient's room or patient's area, baby bassinets and all. You have to wet mop it with 1% sodium hypochlorite solution. Allow it to dry properly. So that is carbonization, essentially. Bedpans, urinals, the housekeeping department, they have to make sure that these has to be rinsed properly in 82 degrees Celsius for at least 2 minutes. Okay, and then it has to be passed on to a new patient with detergent water. Okay, and if that is not possible, for 24 hours or for 24 hours in 7% Lysol or in 3 to 5% sodium hypochlorite solution for 30 minutes, you have to soak these bedpans and urinals and then washed with water and soap, dried in sunlight, and then a new patient can use it. Okay. So if you have the Lysol option for 24 hours, if you have the sodium hypochlorite option of 3 to 5% sodium hypochlorite is there, then for 30 minutes. Okay. So that knowledge housekeeping department should have. Washing bowls and all, just with detergent water you can clean, just like how we wash the utensils. Okay, and dry it. And mopping clothes and all that, the housekeeping department will take care of it. Daily they have to send it to the laundry. Okay, smelly mops should not be used again and again. Okay, whatever mopping clothes are there, okay, mopping brushes are there, the infection control nurse or officer should make sure that the housekeeping department is washing it, drying it on a daily basis. Okay. Curtain rails as for bed ends, hand basins, okay, detergent water. Curtain rails also same carbonization can be used. 1% sodium hypochlorite solution, wet mop it, okay. Lockers also, this the same 1% sodium hypochlorite can be used, or detergent water can be used for wet mopping after the patient has been discharged. Mattress and pillows once in a while for 24 hours, sunlight, you have to keep it in direct sunlight. That is the best way. Okay. Macintosh and all, if it is there, it has to be washed with soap and water, dried, powdered well. Okay. Or 7% Lysol also can be used as a disinfectant. Nail brushes is not used for hand washing because it causes micro tears on your skin, and that puts the healthcare worker at a higher risk of getting infection. Okay. So skin damage may be caused by nail brushes, so that is discouraged now. These patient equipments like toilet bowls and all, daily cleaning has to be done by the housekeeping department. The infection control officer has to take note of it, that public toilets and patient toilets are cleaned on a daily basis. Okay. Toilet brushes also should be rinsed in with flushing water. It should be stored dried. It should not be smelly. Okay. Walls, whatever removable visible soiling is there, you can remove it, scrape it if possible. If it is tiled walls, then with detergent water you can mop it. Trolleys as well, wet mop with detergent water or 1% sodium hypochlorite solution. Any one option can be done. Ampules and vials, discard it after each use if it is a single use ones. And before opening or piercing the ampules or vials, just wipe it with spirit and then open it. Cardiac monitors and defibrillators, ECG equipments, if you have used it on the patient, then the surface that touches the patient should be cleaned and disinfected before you use it on another patient. Okay. Usually the ECG equipments and all. Fixtures and fittings, that once in a while housekeeping has to take care, that dusting has to be done daily. Furniture as well. Damp dusting has to be done daily with warm water or detergent or 1% hypochlorite solution. Anyone can be used. All the horizontal surfaces, always remember, all the horizontal surfaces should be cleaned on a daily basis. Horizontal surfaces should be cleaned on a daily basis. So that's all for today. If you have any queries, you can mention in the chat box.